Today, in short, we will discuss a topic on Meckels syndrome. It's also known as Meckels-Gruber syndrome. It is an autosomal recessive pattern of inheritance disorder, which means that 25% of the child born to the affected parents may have the disease. Moving on to incidence, it's more common in European countries. The interesting part in this and the relevance of the topic lies in that it is seen in parts of India, more commonly in Gujarat population, with an incidence of 1:2300. It is also called as pseudotrisomy 13 because it has some similar clinical features of the trisomy 13 syndrome. Hence, it is called as pseudotrisomy 13. Moving on to pathogenesis, the pathogenesis underlying Meckels syndrome is celiopathy. It is a celiopathic disorder. So some of the familiar celiopathic disorders which you might have come across is polycystic kidney disease and Bardet-Biedl syndrome, etc. And there are about 13 genes affected, as named as MKS 1, 2, and 3. MKS refers to Meckels syndrome. If you see cilia, it can be classified into 3 types. One is in motile cilia, 2 nodal cilia, and 3 primary cilia. The motile cilia is of a configuration of 9 plus 2, whereas your nodal cilia is 9 plus 0, and primary cilia is also 9 plus 0. Later on, I will discuss a cilia in a separate topic. Now, just I will have a look in short or in precise about the celiopathy underlying Meckels syndrome. So, the role of motile cilia is that it is a 9 plus 2 configuration. It has a central microtubule which differentiate it from the other two nodal and the primary cilia, in which there is absent of the central microtubule and radial spoke. The difference between nodal cilia and primary cilia is that in primary cilia there is also a absence of dynein and nexin. So from this point you can come to a conclusion that if dynein is absent, then the role of primary cilia is not involved in movements or locomotor activity, locomotion, whereas your motile cilia and nodal cilia are involved in locomotion, in which the motile cilia generates a whip-like motion or a wave-like motion, whereas your nodal cilia is responsible for rotatory motion. Your whip-like or wave-like motion of motile cilia is most commonly seen in upper respiratory tract and CNS ependymoma and reproductive tracts, whereas your nodal cilia are seen in your embryo, developing embryo. And coming to primary cilia, which I will discuss in somewhat detail, because they say that it is most commonly affected in Meckels syndrome. So basically it lacks central tubules and nexins or dyneins. So it lacks central microtubule, a pair of central microtubule, kinin, dyneins, nexins, and a radial spoke. So basically it has only a ciliary membrane. So its function is basically as an antenna. It just functions like an antenna which receives the signal and transduces the signal, just like an antenna. Is called, its main function is the sensory function. It can sense the chemical function or the chemicals known as chemosensory or pressure, or called as mechanosensory function, or your temperature, which is called as thermosensor. So it can be a chemosensor or mechanosensor or a thermosensor. So most common sites where you see these are your olfactory, your photoreceptors, and your kidney, liver, and in bones and cartilages. So The primary cilia is involved in sensing, so they are called as sensor. Based on their function, they may be classified as chemosensor, mechanosensor, thermosensor. They are most commonly located in olfactory, epithelium, photosensor, photoreceptor, bones, cartilages, kidney, liver. So moving on to clinical feature. It has a classical triad. So the triad is comprised of one, there is an occipital encephalocele, which means that your brain, the meninges come out of the defect in your bone, which is the occipital bone. Hence it is called as occipital encephalocele. And then you may have polycystic kidney disease, or you may have a post-axial polydactyly. So among these, most common is polycystic kidney, followed by second most common is your occipital encephalocele and your post-axial polydactyly. See, you can very well appreciate your polydactyly, post-axial polydactyly. See, 1 2 3 4 5 6, 1 2 3 4 5 6. Apart from these three classical triads, such as your polycystic kidney, your occipital encephalocele, and post-axial polydactyly, there may be other future features such as hepatic cyst. Moving to CNS, there may be also Danty-Walker malformation, agenesis of corpus callosum, then microphthalmia, coloboma. Moving to CVS, it may be associated with VSD or ASD or coarctation of aorta. Lungs, there is hypoplasia of lungs. So moving on to your diagnosis, it can be made by your estimation of maternal serum alpha fetoprotein, or you can do antenatal ultrasound, which I showed earlier. They can pick up your occipital encephalocele or your polycystic kidney. So what is your prognosis here? Prognosis of the disease is very poor. It's a very poor prognostic disease. The cause of death would be either due to neonatal renal failure or from a pulmonary hypoplasia. So this is in short I have told you about Meckels syndrome. So I have told you there is a classical triad in which polycystic kidney disease is the most common. It is followed by occipital encephalocele, most 70%, what is holoprosencephaly. See, mainly in CNS, Meckels syndrome in CNS affects the posterior fossa. This can also be asked that in Meckels syndrome, the most affected part of your brain is posterior fossa. Next, I have told a picture on cilia. In this, most common affected is your primary cilia. Coming to incidence in India, Gujarat population is most commonly affected with incidence of 1 in 1300.